You shouldn't have to rehearse for your doctor's appointment like it's a job interview, but here we are anyway. Have you ever left a doctor's appointment feeling like you weren't heard, like your symptoms were minimized, or worse, that they were ignored entirely? You're not imagining it. Many patients, especially those with chronic symptoms, rare conditions, or complex histories, experience medical dismissal. And that dismissal isn't just frustrating, it can delay diagnoses, erode trust, and seriously impact your care. I'm Dr. Goodwin, a board-certified family medicine physician with 2 chronic diseases myself, and today I want to give you a set of phrases you can use in real time when you feel the conversation slipping away. These are tools. They're not magic wands. I cannot promise that they will work perfectly every single time, but they can help you stay grounded and redirect the visit with calm authority if necessary. If you want more structured support, I created a free doctor visit prep sheet that walks you through what to bring to your appointment, what you can say at your appointment, and questions to ask. So you can download that down below. Before we get into what you can say during a tough appointment, I want to talk briefly about why medical dismissal happens in the first place. Not to excuse it, but to help you understand the system that you're walking into. There are 3 main reasons why doctors may seem dismissive, hesitant to order tests, or too quick to shut down a possible diagnosis that you are worried about. The first one is time pressure. So most of us get 15 minutes per visit, and we are trained to listen carefully for the first 8 to 10 minutes and then switch into a diagnosis and explain mode for the last 5 to 7 minutes of the appointment, where we tell you what we think is going on and what we want to do about it. That time is really tight. So if we don't know a patient very well, we can default to what's called system 1 thinking, which is fast, it's automatic, it's pattern-based decision making. And it's very useful. It's how we catch things in the emergency room like heart attacks or strokes. But it can miss nuances with chronic disease and chronic symptoms. What we should be doing in the exam room, especially with patients with chronic disease, is system 2 thinking. This is a slower, more analytical process that requires time and mental space that we don't always have. I know for myself, I oftentimes have to spend time after the appointment, maybe that evening or that weekend, thinking through a patient case a little bit more. Unfortunately, we don't always have time to do that, and this can lead to missed diagnoses or minimized symptoms. Number 2, we don't always explain our thinking very well to our patients. So sometimes we can recognize that a symptom will likely resolve on its own, but we can fail to explain well to our patients why we think the symptom will resolve on its own, why we're not ordering a test or we're not ordering a treatment for it. That silence can feel like indifference or disbelief when actually most of the time we think we have explained ourselves and we just haven't explained ourselves well enough, especially to patients who have been brushed off before or perhaps have done a little bit more searching online and are really anxious about a particular condition. And the third one is probably the main one, the most important one. There is a real pressure on us not to order too many tests. So this one is a little bit complicated. A lot of my patients get very confused about it, but over testing, so ordering lab tests or imaging tests for every single symptom can actually cause harm. And we take an oath to do no harm, so we oftentimes try to avoid over testing. The way that this can bring harm to patients is because of incidental findings, which is finding something else that we might have to work up or treat that doesn't necessarily need treatment. And it can be really expensive for patients if we find a false positive or something else that we get worried about and then it turns out to be nothing after we've ordered 3 more tests. But also, behind the scenes, we medical providers are being graded. We get metrics on how efficient we are with our testing. So we actually get statistics every single year about how much money we're spending per patient per year with the tests that we order. And the less we spend per patient, the better we're rated as medical providers. This intends to reduce waste. It's good intentions. but it can be very dangerous when applied to people with unusual symptoms or early warning signs that are going to turn into a chronic disease. I've definitely had colleagues frown at me for ordering labs after 3 or 6 months of symptoms, which is kind of my personal cutoff. Every physician has their own way of working through things if we don't necessarily have a guideline for it. And mine is, if you've had symptoms for 3 months or especially 6 months, then I'm going to go ahead and order a workup. And that's how I've caught autoimmune diseases and sometimes even cancers years before the average diagnosis. Now, the good news is the landscape is shifting. As tests become more affordable, patients are more informed and assertive, we're seeing more nuanced care. Wait and see still has its place, but so does an earlier workup, especially when symptoms linger or they are changing. So with that context, how can you prepare yourself for a difficult visit? First, I want to acknowledge something hard. In an ideal world, you shouldn't have to manage your emotions or rehearse your words just to be taken seriously. But many patients, especially women or people with a higher weight or age, more wisdom, I like to say, those people with chronic conditions, we have learned the painful truth. If you get emotional in the exam room, you are more likely to be labeled anxious, non-compliant, or even difficult. So, if you are gearing up for a tough appointment, here's what I recommend. Write down your top 1 or 2 concerns or symptoms that you have that you want to focus on for your appointment. List your most 3 important questions, and then bring a summary of either the main symptom or symptoms that you've been tracking and your relevant medical history, preferably a summary that's 1 to 2 pages long. My patients who bring in a Word document or a written history of just the main highlights of what's gone on in their medical history are my favorite patients. I love them so much because it makes my job so much easier. If you want help with symptom tracking or medical history tracking, I have free workbooks on my website, and I will link those in the description below as well. Okay, so you've thought through everything that you want to say, you've got your questions written down, you're still feeling really frustrated and emotional. I want you to take a moment to journal how you are feeling about your health and about your medical providers and about the medical system as a whole, or talk it through with someone that you trust, because you deserve to process your frustration and anger and heartbreak and grief. And I don't want you to feel like you have to carry that into the exam room by yourself. It's unfortunate that patients who are emotional oftentimes are less likely to get the diagnostic test ordered that they need. So the more rational you can be, the more likely you are to get the care that you want or that you're looking for. And please don't hesitate to bring a support person with you. A friend or a family member can help you take notes. They can provide backup, maybe their perspective on your medical history, and they can help you get your concerns across in a way that can be heard and understood. So having someone in your corner can make a huge difference, and I really believe that everyone should have that kind of support with them. I know I always take my husband with me, and I really appreciate his perspective, especially after the appointment. Oftentimes he hears something slightly different than I did, and he can help me kind of figure out what I think and feel about what the doctor said. Okay, part 2. What to say when you're feeling dismissed. So let's walk through these 10 phrases. Each one is paired with when to use it, what it's supposed to communicate, and then how your provider might respond to it. So, number 1, you can say, I'm concerned that this particular symptom or this particular problem is being overlooked. Can we come back to this? So you want to use this if you feel like your medical provider has just kind of brushed past your concerns or said, hey, this is just anxiety, or you're just tired, or maybe, hey, you just need to lose weight. You can stop and say, hey, let's come back to what I'm worried about. So this signals importance without any kind of confrontation, because you're not arguing, You're just saying, hey, this is something that's really important to me. And your provider should be fairly neutral to receptive to this, okay? So if they get defensive, stay calm and just repeat, I'm concerned about this. Can you tell me what this could be? Or can you tell me why you're not concerned about this? And that is actually line number 2. Can you help me understand why this symptom isn't concerning or why you don't think this symptom is concerning? And you want to use that again when you feel like they're brushing past whatever you're saying. And this is asking for clinical reasoning when you want a dialogue with someone and not necessarily an argument or a debate. Oftentimes your provider is going to say, well, because of X, Y, and Z reason, or maybe because your labs are normal, I don't feel like this is concerning. I think this is going to just go away. Which leads to line number 3, where you can say, I'm very glad that the labs are normal, but I'm still not feeling normal. I'm having X, Y, Z symptoms. So what else could we consider if the labs are normal? So use this if you feel like you have normal labs, but you are still having a lot of fatigue or a lot of pain, or maybe some kind of autoimmune symptoms, like people have a lot of trouble with their hair falling out, or they get joint pains or muscle pains. And I have a lot of female patients in their 40s and 50s who really struggle with this, really struggle to get heard in the doctor's office. And again, if it has been 6 months at least of consistent symptoms, there is nothing wrong with saying, hey, I'm willing to pay the money for testing, even if the insurance doesn't cover it. Hey, I want to go to a bigger city that has a specialty clinic, because there are clinics in bigger cities that specialize in cases with chronic pain, chronic fatigue, chronic autoimmune symptoms. And you can say, hey, I want a second opinion at one of these big medical centers, and your provider should be more than happy to send you. Every provider that I know and that I've worked with has said, yes, absolutely, let's do it. Line number 4, you can say, I don't feel like we've fully explored this yet. Is there a next step that we can take? So if you feel like your provider's wrapping up and they're getting ready to leave, you can say, hey, I'm feeling like I'm not quite done with this symptom or this medical problem. What would be the next step, either with workup or treatment? And you want to reframe the visit, right, as something collaborative that you are doing together. And one of the things that you need to be willing to do here is listen to what your medical provider is saying and try what they say. I have a lot of patients come in who say, I want, an MRI. And I say, hey, I think you need physical therapy first for your knee pain and x-rays. And they can get really frustrated. But if you can give your provider a month of trying their option and then come back and say, yes, actually that worked, physical therapy was great, or no, I'm not any better, in fact, I may be worse, now can you order my MRI? We are far more likely to order the test that you are looking for if you have tried what we recommended first for at least 4 to 6 weeks. Unless it's a medical emergency, in which case just go to the emergency department. That's a different video that I'm gonna need to make. Okay, line number 5. This might not be an emergency, it might not be urgent, but it's impacting my daily life very severely, and I'd like to find out why. So this is a great phrase to use if you have something like chronic fatigue, or maybe your hair falling out, or just having low energy, and it's impacting your daily life dramatically, but your provider says, hey, we've done the workup. The basic labs are normal, your imaging is normal, this is probably just that you're not sleeping and you're stressed out and you're doing too much, which is honestly causes a lot of symptoms for a lot of us. So if you feel like it's worse, and I should make a video on chronic fatigue, maybe that will be my next video. The big deal with whether or not chronic fatigue is an actual medical problem versus just the lifestyle that we all live, where we don't get enough sleep and we do too much, is whether or not sleep is restorative. So if you have a weekend where you can sleep for 12 hours and you wake up after that 12 hours and you feel just as tired as you did before you went to bed, like you don't feel any better, any rested at all, that's when we start looking for a medical diagnosis for chronic fatigue, as opposed to saying, okay, if you feel better after you get 12 hours of sleep, even if it's just a little bit better, then you need more sleep. You need to cut back on your lifestyle a little bit and prioritize rest for 3 to 6 months. And then most of the time, if it's not a medical diagnosis of chronic fatigue. If it is just our lifestyle, that resolves the problem. Okay, I'm getting sidetracked. Line number 5 is, this may not be urgent, this may not be serious, this may not be dangerous, but it's impacting my daily life and I'd like to find out why. That signals to your doctor that you are willing to drive 3 or 4 hours to a big hospital center to see a specialist, or you're willing to pay for labs and imaging that may not be approved or paid for by your insurance company. And so that will signal to your provider, hey, I'd like to get the test anyway, and oftentimes they will go ahead and order them for you. Okay, line number 6, can we document that I brought this up today? So this is a really good one if you don't feel like your provider heard you. Maybe you're seeing someone that you don't normally see and you just want this in your medical record so that next time you can say, hey, I said this 2 months ago, or I brought this up 3 months ago. This is still a problem for me. I'd like to get a workup. This signals that you're serious about it and that you want to establish a paper trail. Most of the time, I don't have patients ask me this unless there has been some kind of assault and there's a chance that my records could be subpoenaed for a court hearing. But this is also a really good way to just ask people to get your symptoms documented so that 2 months, 3 months, 6 months later, you can come back and say, hey, every single visit I have said, I have this problem. Can we do something about it? And of course, by 3 to 6 months, most providers are going to say, yes, we need to do something about this. Line number 7, I'm tracking this particular symptom, whatever it is, pain, fatigue, weight gain, weight loss, hair loss, whatever it is. Can I show you what I've noticed? So this is really great if you have a symptom tracker. And like I said, I have one on my website if you need it. Let's say you're having gut issues or blood pressure issues or something like that. And you can actually point to, on this date at this time, I had this symptom for this long, and this is how severe it was, and this is what I did to make it go away, or this is what made it worse, this is what made it better. That really helps us. If I have patients who can bring in a tracker, even if it's just 2 weeks of symptoms for, like, say, gut issues or migraines or something like that, it helps me get to the correct treatment so much faster. So it's one of the most important things I think you can do if you are having chronic symptoms. Line number 8, what would you do if this was happening to someone in a different age bracket or the opposite gender? So oftentimes this one can be kind of confrontational. So you're kind of calling them out on bias or assumptions, but I have definitely heard women using this with male providers where they say, hey, I've come to you and said that I'm having joint pain, fatigue, hair loss, low energy, trouble sleeping for 6 months to a year. You know, what would you do for a workup if I was a man instead? And I kind of caution you with this one because I feel like it can be really confrontational, but I have also had some patients who have used it with fairly good success where they say, you know, actually, I would probably order more of a workup, and then you can say, can we get that workup? Line number 9. This one is for patients who may have a little bit larger body, a little bit more weight. I know that a lot of patients get dismissed because they're having, like, let's say knee pain or fatigue or shortness of breath, and the medical provider says, well, you just need to lose weight. And so you can say, I understand that weight can be a factor, but this started before I had any weight changes or before I had weight gain. And, or you could say, you know, this has been going on and getting quite severe and it's getting worse and my weight hasn't changed at all. Can we look at this, what we would do if my weight wasn't a factor? Okay. And that one you have to say it very calmly. Otherwise it's going to sound confrontational as well. But that one is also going to call out bias and say, hey, I understand that probably weight has a little bit to do with it, but I still want a workup to see if there's something else going on. Like if you have arthritis, it's like, if my knee hurts, can we look for a tendon problem, a joint problem, an arthritis problem, even if I also understand that there's probably some issues going along with the weight. If your medical provider doubles down and says, no, I really think this is only coming from your weight, ask them to at least document it as a separate concern. So they would say in their chart something like left knee pain, and I believe that this is coming from the patient's weight and that they need to lose weight. And then if you can, lose 5 or 10 pounds and then come back in 3 months and say, hey, I'm still having the same pain, or I have lost weight and it's getting worse, my symptom is getting worse, that is another good cue for providers where then they will go ahead and say, oh, let's do more of a workup there. And line number 10, which is on the same topic, you can say, I'm open to the possibility that weight is part of the issue here. I'm open to discussing my weight as part of the issue, but today I'd like to focus on this specific symptom, whatever it is, let's say shortness of breath, separately from my weight. So use this if your visit gets derailed by your doctor giving you a lecture about your weight. Set a boundary there with respect, kindly, calmly just say, I'm open to discussing my weight in the future, but today I want to talk about my shortness of breath, or I want to talk about my joint pain as a separate symptom. All right, so what to do if this escalates? So most providers, especially if you stay calm, are going to be so open and receptive to these sentences. They're going to say, oh yes, absolutely, let's work together, because we want to help patients get healthier. What happens if your provider doesn't listen to you, they get defensive, they escalate, they become impatient, they shut down, they say something rude? If that happens, please stay calm. I have seen so many posts on social media encouraging patients to yell, to demand things, to threaten lawsuits or poor online reviews. Please do not do this. It does not help you in the long run. Just stick to the facts. Ask for documentation. Ask them to write these things down in your chart, not only your concerns, but also what they believe your concerns are, because then other providers can look at that and say, I don't know if I agree with that. And then ask for a copy of your visit notes. Your medical record is yours by law. They actually do not have the ability to keep it from you. They probably cannot give you your visit note immediately because it takes us usually 24 to 48 hours to finish and close every note. But by your next appointment, you should always be able to get the notes from your last appointment. And normally we are also supposed to always give you a summary of what we talked about and the things that we recommended that you change to improve your health. Not every clinic can do it, but most clinics do. So you should walk away with some kind of documentation. And then if you need to, consider bringing an advocate, bring someone with you next time, or if trust breaks down completely, find a different medical provider. That is a-okay to do. Ask for a second opinion, find a new primary care provider, something like that, because you are not too much. You are asking for basic respect. You are asking for safety, for communication, for honesty. And if you're not getting that, then sometimes it's time to find a new provider. All right. If this video helped you feel more prepared or less alone, I hope you'll subscribe. I make videos to help patients understand their health, advocate for themselves, and stay grounded in medical systems that don't make that easy. If you want help preparing for your next appointment, you can download my free doctor visit prep worksheet below. It's a gentle guide to help you organize what to bring, what to say, and how to protect your energy, because you deserve to be heard. And if you're struggling with feeling heard, I think you would really benefit from organizing all your medical records and then tracking your medical history, which is what I talk about in this video right here. We'll see you there.